Hey guys, welcome back to my channel, The ENT Resident. Today we'll be discussing a clinical test that we perform while examining the nose, and that is Cottle's test. You can also now purchase my notes. I have added links in the description. Okay, so let's talk about Cottle's test. What is Cottle's test? Cottle's test is basically a clinical test that we perform while examining the nose of a patient and where we are assessing whether there is an internal nasal valve collapse, which is a very common cause of nasal obstruction. How do we perform this test? If you see in the image over here, the examiner places two fingers on the cheek just lateral to the nose. Then you gently pull the cheek laterally to widen the nasal valve area. And then you ask the patient if the nasal breathing has improved or not. And based on their answer, we interpret if there is an internal nasal valve collapse or not. So here we are basically assessing whether there is a collapse of the internal nasal valve. So we should also know what are the boundaries of internal nasal valve. The internal nasal valve is bounded medially by the septum. You can see in the image over here, the medial boundary is the septum. Laterally is the caudal edge of the lateral cartilage, upper lateral cartilage, and the head of the inferior turbinate. You can see this is the lateral boundary. And inferiorly, it is bounded by the nasal floor. So these are the boundaries of the internal nasal valve. Now let's talk about how are we going to interpret the result of Cottle's test. So if the patient says that the nasal airway improves, or rather the breathing improves on performing the Cottle's test, it means that this is a positive Cottle's test. And this, in that case, will suggest a presence of an internal nasal valve collapse. If the patient says that there is no improvement at all, that means we have a negative Cottle's test, and this interprets that the obstruction is probably due to any other cause. For example, it could be due to a deviated nasal septum. Next, let's also talk about what is the clinical significance of Cottle's test. So, the Cottle's test, first of all, it helps you in identifying functional nasal obstruction. It helps you in planning functional rhinoplasty. And this is a very easy, simple, non invasive bedside test that you can perform in just a minute. And it gives you a lot of information about the nasal obstruction that the patient comes to you with. So that's all about the Cottle's test. If you have any questions, note them down in the comment section and I'll get back to you. Thank you.